How you doing, mate? I am living the dream. Or is it a nightmare? I'm not sure. Sometimes. No, all good. Started the day off with some diagnostic calls. A couple of inpatients, all doing really well, to be fair. Again, actually, everybody's super happy today, which is kind of what we want, obviously. The journey to hormone optimization takes time and effort, and I think the guys know that. So, you know, the new patient consultation that we give them is very structured for a reason. It's to give them the realistic expectations. And you know, the whole earn your reward comment, it comes in, they understand what they need to do, and you know, we're here to guide them, but they're the ones putting the work in, essentially.
So what was your approach to starting the clinic?
Basically, I was so tired all the time, didn't know what was going on. There's lots of social media going on, telling you, you test your testosterone, make sure you see what's going on in your body. I was overweight, I was smoking 30, 40 cigarettes a day. Health was really bad. I got a 4-year-old and just needed to sort my life out, really, more than anything else. And I came down to see Rob, and he was absolutely brilliant. He didn't treat me like an obese idiot. He just looked after me like a proper human being, which is really, really good. So that's why I carried on, really. That's it, really.
You're quite new to the clinic.
Yes.
So what made you choose our clinic over other clinics in regards to knowing you had to come in?
I think the information that was on the website, the professionalism, the friendliness of the clinic answered all my questions from the very beginning. I was under another clinic before. I didn't get the same level of service or satisfaction, but here I come in, I've got the answers, I can talk to someone on the telephone and nothing's too much trouble. I get the answers.
What's been some of the biggest changes since starting treatment?
Energy, how you feel, not always tired, and actually being sociable again. I know it sounds ridiculous, but I'm quite a sociable person, and actually being able to go out and socialise and not being, I want to go to bed now, I want to go to bed. Always falling asleep on the sofa at 9 o'clock and being tired in the morning. It's just really changed me to give me some energy back, really, more than anything else.
Now week 11 of the journey with you guys on the testosterone. It's made a massive impact in my life, positive one. It's made me able to train much better. I feel great about myself.
Why are you choosing to do a face-to-face appointment with the doctor rather than online?
Well, I actually feel like I'm treated as a human being when I come down here. More value out of it. And it's actually a day out, a day working on myself rather than on anyone else. It's actually being a bit of a selfish day coming down here, because it's 3 hours to get down here and 3 hours to get back. So I'm in the car for a long time. And it's just good value for yourself, really, more than anything else.
Do you think you'll still come into clinic to get that face-to-face contact with the doctor?
I think so, because there's times when, you know, during conversations you have those trigger moments where you think, oh, okay, I never thought of it from that perspective. Like today I had a conversation about some of the mood differences I've noticed. And sometimes it's only when you have those deep conversations that you actually understand a bit more about why. Obviously you're talking to medical professionals who know exactly what they're talking about, rather than, you know, something you see online or you're guessing on Dr. Google or whatever else. So yeah, from my perspective, it makes a massive difference to have that human interaction.
Sweet. That's it. Simple, tick off.
Brilliant, mate.
Job done.
That was excellent.
Thank you.
Yeah.
It's okay?
Yeah,
Lovely.
thanks so much.
Okay.
Yeah.
Fab.
So literally simple. In and out.
That's good.
Isn't it?
Cheers.
No worries
No worries.
at all.